welcome back to the channel of the PVDUMC Quizzing Society. So, I am Susmita Gokhale, the Vice President of the PVDUMC Quizzing Society. And today, we'll be the packet 10, which is on the MCQs of the previous topic that we discussed, which is vasculitis. So, before starting with the MCQs, I would like that after you read the MCQs, please pause the video before seeing the answers. Try to test your knowledge on vasculitis and then go on with the answers. So firstly, in this MCQ, as we previously learned in the snippets, we'll read the last line of the question and then go on with the solve. The last line of this question is, which of the following is the most likely finding on arterial biopsy of this patient? Then we'll read the options, which are A, leukocytoclastic vasculitis, B, immune complex deposition, C, multinucleated giant cells, D, fibrinoid necrosis. So now we'll go on with the important points that are present in this MCQ. So the key points are the symptoms, which are scalp tenderness, jaw claudication, and intermittent fevers. The most likely diagnosis, according to this history, will be giant cell arteritis. And the most likely finding on an arterial biopsy will be multinucleated giant cells, which is option C. But let us rule out all the options first. So A is leukocytoclastic vasculitis. So this type of vasculitis is typically associated with small cell vasculitis, which is characterized by neutrophilic infiltration and fibrinoid necrosis, which is not seen here. Then next is immune complex deposition. It's systemic lupus erythematosus or post-streptococcal glomerulonephritis, where immune complexes are deposited in tissues. The option C is multinucleated giant cells, which according to me is the most appropriate options, but we should never choose the option that directly and read all the options first. Then we move on to D. So D is fibrinoid necrosis. So this type of necrosis is clinically characteristic of vasculitides like polyarteritis nodosa, which affect the. So again, this is not the answer for according to the clinical diagnosis. Hence, the most likely answer is option C. Now we'll move on to the answer. Yes, the answer is option C. Moving on to the next question. I hope you have got the answer for the previous question without seeing the answer. So we'll again read the last line of this MCQ. So, a history of which of the following is most likely to accompany this man's current symptoms? So, option A is option B is HIV infection, option C is Campylobacter jejuni infection, option D is Epstein-Barr virus infection. Then now we'll find out the important points from this question. So, the key points are that the symptoms show fatigue, weakness, difficulty in fine motor task, painful skin nodules, and sensory deficits. And the biopsy finding shows transmural inflammation of the muscle arterioles along with fibrinoid necrosis of the wall. So the most likely, according to this history, as there are tender nodules and non-blanching red purple rash on the lower extremities, it will be polyarteritis nodosa. So polyarteritis nodosa, as I said, so PAN is associated with Hep B. So it is commonly associated with chronic Hep B infection. So according to me, the most likely answer is hepatitis B infection. So the answer of this question will be option A. HIV can be associated with various vasculitic syndromes, but it is less commonly linked with PAN. Hence, that won't be the correct answer. Next, Campylobacter jejuni is commonly associated with Guillain-Barré syndrome and not with PAN. So this option is also wrong. Next, Epstein-Barr virus is associated with various conditions, but it is not typical of polyarteritis nodosa. So this option is also incorrect. Hence, the correct option will be option A. Now we'll see the answer. I hope you have tried this MCQ on your own. Yes, the answer of the question is A. So moving on to the next MCQ, which is the MCQ 3. We'll first read the last line of this question. So antibodies of to which of this are found in this patient? So A is type 4 collagen, B is myeloperoxidase, C is glomerular basement membranes, and D is proteinase 3. Now we'll take the key points from this question. So the key points are respiratory symptoms, which are cough, blood thin sputum, and nasal discharge. And the constitutional symptoms, which are common for vasculitis, which are fever and weight loss. And the proteins, which are commonly seen in granulomatosis with polyangiitis. And the associated antibody, GPA, is proteinase 3. So GPA is a type of vasculitis which commonly affects the small to medium-sized blood vessels. It is characterized by granulomatous inflammation of the respiratory tract and the kidneys. And in this, the serological hallmark is presence of CANCA antibodies, which targets proteinase 3, which is PR3. So according to me, the most appropriate option is option D. But let us rule out all the options first. So option A is type 4 collagen. So antibodies against type 4 collagen are commonly seen in Goodpasture syndrome, which is not the diagnosis here. So we'll rule out this option. The option B is myeloperoxidase. So antibodies to myeloperoxidase are MPO ANCAs, which are not seen in GPA. So we'll rule out this option as well. The option C is glomerular basement membrane. So antibodies to glomerular basement membrane are seen in Goodpasture syndrome again. So this will be the correct option as well. Hence, the correct answer will be option D. Now we'll see what the answer is. So yes, the answer is option D. I hope this video has helped you. And I'm pretty sure if you're participating in the quiz on the 31st of August, this video will be definitely helpful to you and even the previous video of vasculitis. So if you have any doubts, you can put them in the comments below. And please subscribe and like and share the BVDUMC Quizzing Society YouTube channel. And if you have any doubts regarding the channel or regarding the society, you can message us on the email, which is bbdumcquizingsociety@gmail.com. Thank you.